Yes, this species is totally extinct in the wild. There's, like I said, I think only about 180 left in northern Africa right now, and it's all because of reintroduction efforts.
Hello, I am Caleb Murphy, third-year veterinary student at the Texas A&M College of Veterinary Medicine. I am with Pierre, a partner in environmental education and rural health. In our interview series, Careers in Veterinary Medicine, we have Dr. Walt Cook, a wildlife veterinarian and professor at Texas A&M. He has done research on anthrax, brucellosis, and chronic wasting disease, and is even researching chemical immobilization agents for wildlife species. Today, he will be discussing his role as a wildlife veterinarian.
Okay, well, so I'm a wildlife veterinarian, and I work at Texas A&M at the College of Veterinary Medicine, so I do a lot of teaching and other things too, in addition to actual practicing of veterinary medicine. But I don't touch domestic animals at all. It's just strictly wildlife, and so it's unique. I work a lot with Parks and Wildlife when they're working on free-ranging wildlife, but I also work in the captive ranching industry where they have captive wildlife that people own privately. And so I go out and help those folks. You know, like I said, I don't have a clinic. My clinic is the fields, the wild, if you will. So kind of unique in that regard. Well, when I was younger, I always had a strong interest in wildlife. I grew up in a rural community, did a lot of hunting and fishing and just being outdoors in nature. So I always really loved wildlife, but I also had a real strong interest in veterinary medicine, and I was actually having a tough time deciding which route I wanted to go. Did I want to go into wildlife management, or did I want to go into veterinary medicine? And then I started reading about wildlife veterinarians and decided that's the path I wanted to take. Veterinary medicine is a people practice. You work with people every day. Everybody thinks that you're working with animals, and you are, but you're also working with people. So I work with the biologists and the managers at the Texas Parks and Wildlife Department, but also with private landowners and managing their wildlife. And it is very rewarding to see them have their animals do well, have their animals get healthy or stay healthy. That's good because the public likes to see healthy animals. Nobody enjoys seeing sick animals out there, wild animals. But also for landowners, it's economic boom for them as well to have healthy populations of wildlife. Well, I work with everything. I've done a lot of work with elk in the past. I really enjoy working with bighorn sheep. I've got several projects that I've done with bighorn sheep, have worked with pronghorn antelope, and then also some of the exotics that we have here in Texas, which are a lot of fun. Normal day for me is kind of hard to say. Most of my days are here at the university, doing a lot of teaching and research and stuff like that. So the times that I actually get to go out with wildlife are the special days. Those are the days I really enjoy. But that's not an everyday thing. Probably one day out of maybe 5 or 6 or 7 do I actually get my hands on wildlife. Most of the time is actually spent in front of a computer or in a classroom or in a laboratory. So actually that's one of the really big advantages about this field in the state of Texas is because of these ranches, that it's a very nice opportunity for veterinarians who are interested in doing some wildlife work but not wanting to be 100% wildlife all the time. You can pick up work on these ranches. So I'll give you an example. Somebody who's interested in small ruminants, sheep and goats. Well, sheep and goats are not worth a lot of money, so they're not. Those owners aren't going to typically call a veterinarian out to work on their sheep or goats unless it's a special circumstance, because they're just not worth that much money. But you get to work on some of these exotic animals, some exotic sheep, some exotic antelope that are worth a lot of money. And so they will pay a lot of money to have veterinarians take care of them because those animals are very valuable. So it's a nice way to incorporate that into private practice. Well, I've had a lot of really good, fun experiences. Been able to get up in helicopters quite a bit and do helicopter wildlife captures. Those are a lot of fun. But probably the funnest experience I ever had was we were capturing Rocky Mountain bighorn sheep when I was in Wyoming, and we were doing it in the mountains in the wintertime, so we were darting them off of snowmobiles. So that was just a blast. Well, in the United States, flying in helicopters is problematic because of liability concerns. Before an agency is going to allow you to fly in a helicopter, they're going to require that you get training or certifications that prove that you can be safe in a helicopter. So I've been through some of those trainings, and that's given me the opportunity to do that. In other countries, like in South Africa, basically anybody can get in a helicopter. They don't have those liability concerns. But it takes a fair amount of work to get the ability to do that, but it's worth it because it's a lot of fun. Challenges a wildlife vet has to deal with, well, if you're dealing with free-ranging wildlife and wildlife management, which I did in a former career, you have budgetary problems. You also have different people who have different opinions on how wildlife need to be managed. And a wildlife managing agency is trying to manage wildlife for the benefit of all people. And so trying to satisfy everybody's needs can be very challenging. Why I do what I do is because I love doing it. I love wildlife. I also really love working with students and hopefully passing on some bits of wisdom to them. And so that's my motivation. That's what keeps me going. So the animals that I work with is probably about 50-50. The stuff that I do with Parks and Wildlife tends to be more free-ranging wildlife. The stuff that I do privately is, of course, behind a high fence, often on very large ranches, but they are fenced in on those high fences. So, we're very fortunate in North America that our wildlife populations are doing well. Our native wildlife populations are doing well for the most part. Obviously, there are some exceptions. But if you look at across the world, there are lots of regions where wildlife are not doing well. So there are many species, particularly North African species. There's a Scimitar Horned Oryx, which is extinct in the wild, that we have on ranches here in Texas. So those ranches are preserving those wild animals. There's Dama gazelle, there's addax, there are Peer David's deer from China, that all of those species are species that are either critically endangered or actually extinct in the wild, and we have them doing well here on ranches in Texas. If you're interested in wildlife veterinary medicine, you need to learn about wildlife management. The veterinary medicine part, that comes in, you'll get that in veterinary school, but the wildlife management stuff is stuff you'll have to pick up outside of that. So you can do that in college by taking wildlife management courses, but also volunteering with wildlife managers and wildlife agencies is another good way to kind of learn a lot about what that field is involved in. My, I guess, main advice would be to always keep your mind open, and you never know what interesting challenges you may find. Don't box yourself into saying this is exactly what I want to do, because there's a lot of opportunities out there. So I think the two biggest resources for you would be the Wildlife Disease Association. They have a website that you could go to, and that's pretty broad. It's encompassing all of wildlife and wildlife health issues. But then specifically for wildlife veterinary medicine, there is the American Association of Wildlife Veterinarians, and again, you could go to their website and they will have plenty of information there for you.
We hope you enjoyed your visit with Dr. Cook and have a greater understanding of a wildlife veterinarian. If you'd like to learn more about veterinary medicine, visit our website at vetmed.tamu.edu/peer. Thank you and have a good day.
see here is that there are here David's deer. These are what people call water deer. They really prefer to be wet. They bathe like 5 or 6 times a day. And what we can see behind them are blesbok. They call them bles because they have a white blaze on their face.
So one thing about Scimitar Horned Oryx is when you see the males and females, normally males have bigger horns, but in the case of scimitars, females generally have longer horns than the males do. And the males will have more girth and mass on their base. Also, when you got a big dominant male like that, they get that really dark red on their neck. Whereas like the cows will have kind of a rusty orange that's like a faded white version of that.
That's a target animal right there. He doesn't have an ear tag yet and he needs to be treated. Those are blesbok. Yeah, he figured out our hand. He's already walking away. Let's just stop here and see where he goes. That big axis. So what we're looking for when we're using our binoculars, we're trying to find, okay, if we have parasite issues, they're going to be kind of skinny. And so we're trying to look at the hips and the shoulders and the ribs, kind of see how pronounced they are, see how much body fat they have on them, because those parasites will just take all their energy.
Where do you try to hit them when you dart?
So when we're darting, it's going to depend on the situation, but we want to hit large muscle groups of the shoulder, the rump, or the hip, and that's where we see the best absorption. It's safest for the animal, best recovery. That's kind of our two honeypots is the shoulder and the rump.
How close do you have to be to dart?
So manufacturer recommends not being further than 60 yards.
Oh, man.
However, your accuracy greatly increases if you can get within 40, I would say. We try not to take shots that are longer than 40 yards. So what's the game plan here? You want to just go on these little side roads and go on either side of the group and see what we can see.
There's a road right back over here
yeah,
that
I
runs
see
that middle, you know. So I was kind of thinking one of us would run up there and the other would kind of hang around here just to make sure they didn't come tearing out.
Y'all are a little bit more mobile than we are, so why don't we just sit out here and you can go on there. So I'll turn around and I'll kind of just face this way.
All right. You're good. 44 beats per minute. Yes, this species is totally extinct in the wild. There's, like I said, I think only about 180 left in northern Africa right now, and it's all because of reintroduction efforts.
So I'm going to give her 4, which is enough for 400, which obviously she's a lot less than, but
But for the ivermectin, you're wanting to shoot high.
yeah, because our chances of getting our hands on her again is not very good.
And it's really hard to overdose with Ivermectin.
section in the shoulder, maybe. I'm gonna get right here. No blood.
Let me see. See what I was showing Jamie is there's this abnormal horn growth here. Normally they've got just constant rings all the way around, but you can see right about there something happened where it either fractured the base of its horn or had some sort of cranial abscess or something, and from then on you can see that stripe came all the way down. Every year of horn growth it just got a little bit knobbier,
That's wild.
and it actually caused that horn to kind of kick out to the left there.
What ear would we like to tag?
It doesn't matter.
Doesn't matter.
I mean, generally I do females on the left and males on the right, but
Okay.
I don't think it makes a difference because we've been tagging all sorts of stuff.
Okay. So we'll find a rib where the cartilage is nice and thick, and I'll try to miss. Looks like there's an ear vein right here. I'm going to try to miss that. And so when we're ear tagging an animal, we always let the animal handler know, so we can say 1, 2, 3 tag. I don't want to fold the ear over though.
Just to make sure nobody gets kicked.
Exactly, yeah. So I'm gonna tag this animal. 1, 2, 3 tag.
Oh, she's totally out. Good deal.
There's not a whole lot there, but I think that's gotta be it right
Looked
there.
like it to me.
102.1, good.
I think you went just medial of it. I think it's pretty superficial. I don't know.
All right. Since you got the pleasure of drawing blood, that means you also get to do the feces.
That's fine with me.
Seems like a fair trade.
I don't know, I usually say if we get 4 or 5 pellets, we're usually pretty good.
Really?
I think Charity would be an awful lot of poop.
All right. Well, I got like 15, 20.
So how much reversal are we going to give her? What are we going to give her?
We hit her with 2.5 of Nalmed Ace. That means 5 of Atipamazole.
Very good.
Do you want to give any naltrexone or naloxone?
What do you think?
I'd say no.
Yeah, I say no. She's feeling bad enough as it is. No sense making her feel any worse.
Yeah.
Heart rate was pretty level. Still 44 beats per minute.
Nice. Stable, stable.
Anybody get the respiration?
Not yet.
3, 4,
Good, she's coming up a little bit.
5.
Yeah.
So then we want to check her mucous membranes again. See how that's looking. It's a little pale. That may be from worms more than anything else.
Really?
Absolutely. These hemoccus can.
Anemia.
That's one of the things we'll do with that blood is get a hematocrit too.
Mm-hmm.
That's how-
See if she's low. Yeah.
There's a little bit. So you're fine.
Sort of house too. Yeah. That's possible. One day.
Her breathing's picking up
I,
a lot.
I was just about to say that.
kind of getting some muscle rigidity back in her neck. She's not just flopping over. Her eyes are starting to blink. There we go.
Atipamazole will quickly increase your blood pressure. So
Up at 9:33.
Woo. Well, there you go.
Adios, amigo.